We're going to speak now to Helen Morgan from the Liberal Democrats. Thank you for being with us. So we looked at your manifesto today. You want more money for the NHS, for care, for schools. You want to raise age. You want to increase the size of the army. You want to build more homes, cut income tax. I guess my question is, what's the kind of unpopular policy in your manifesto? Because there's going to be hard choices after the election. What's the unpopular policy in it?
Well, we've tried to really focus on the issues that people raise with us on the doorsteps every single day. So I hope there isn't anything particularly unpopular in there. We've really focused in on the NHS and care, as you pointed out, because
just to explain what I mean, there's a huge challenge after the next election because of high debt, because public services need investment, taxes are historically high. I guess I'm trying to work out which party is levelling with people about difficult decisions that will be made. What's the kind of difficult choice, the unpopular policy in your manifesto?
Well, we really don't want to raise taxes on working people and pensioners because they have really been feeling the pinch with the cost of living crisis. So our taxing plans are based around looking at the big banks and looking at the wealthiest people in society to try and get them to contribute a little bit more, particularly towards this health and social care plan. So what do I mean by that? Well, our capital gains tax plan would involve the top 0.1% of people paying more in capital gains tax, but it would actually be a better system for people who were at the middle level of income because they'd end up paying a little bit less.
It doesn't really sound like an unpopular policy then, does it, to be completely honest? Closing loopholes exploited by the super wealthy. If it was that easy, it'd been done before. You say the manifesto's fully costed, but it feels like it's only fully costed in the kind of loosest sense of the world. Multiple times you're saying you'll only do something when resources allow. So, that's kind of convenient, isn't it? You want to cut income tax by raising the personal allowance, but only when the public finances allow. Why put something in your manifesto at all if you haven't got a costed way of doing it?
Well, I think people need to understand that the public finances are in a really desperate situation, particularly following that Liz Truss budget, which caused interest rates to go up so far. And we have an aspiration to lift people out of income tax by lowering those increasing those tax thresholds, which is what we did when we were in coalition. And but we've got to be level with people. We can't afford to do that at the moment. When the public finances improve, then that's something that we would aspire to do. We can't do that until we grow the economy, and that's why this NHS and care package is so important. There are 7 million people on waiting lists, and those people, we need to get them back into work.
So I'm not sure if I'm being clear, that because the point I'm making is you are saying that you can't afford to do this now, but you've got no time frame on it, you haven't costed it. So why is it in the manifesto? It's not fully costed, is it?
Well, because we need to see this this increase in growth and the ability to be able to make the changes that we want to make. But it's not a key pledge. We haven't gone in there and said, the first thing we're going to do is raise the income tax threshold, because we know that that's not being honest with people. That's why, that's our aspiration. That's where our values would like to lead us. But at the moment, we're not quite ready because the economy is in such a bad state after this Conservative government.
You've got a couple of guarantees in there as well. So you want to guarantee that 100% of patients will start cancer treatment within 62 days from urgent referral. Currently, it's only 60%. You say it's a guarantee, so I guess my question is it statutory? So are you going to be able to sue the NHS under your plans if that doesn't happen?
I think the plan is not for people to be able to sue the NHS, but for them to be able to make, a formal complaint through the official process and eventually get complaint to the Ombudsman if necessary. But clearly we don't envisage lots of people taking legal action against the NHS.
So would it be statutory then?
It would be a statutory right to go through that Ombudsman process if you hadn't received your treatment within the time period available.
You also say you want to guarantee all domestic burglaries are attended by police. So, would that be statutory? Would you be able to sue the police if that doesn't happen?
Well, I think that's a guarantee rather than a statutory right. But, we need to have clear-cut targets and aspirations here. If you come to...
a little bit confused if these are aspirations or if they're in law, as in statutory, then you can take legal action if you fail to meet these pledges.
We don't envisage lots of people taking legal action against our public services because clearly that would be unaffordable. We envisage people having a right that they can make an official complaint around and go through the Ombudsman process if they're not treated fairly under those arrangements.
OK, thank you very much indeed. Great to have you on the programme today talking us through the Liberal Democrat Manifesto. Helen Morgan there.